Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.
Komanso Central, you have the floor.
Thank you very much, Second Deputy Speaker. We have a similar concern with one of our members, Honorable Kapalamula. He has not yet been allocated a seat. We submitted our preference, but I think your office is still looking at it. So I thought I needed to bring it to your attention. Secondly, Second Deputy Speaker, I just wanted to find out whether it is in order to proceed the way we did during the roll call period. Previously, before the gadgets, a bell was rung. Probably it was, I think, for 5 minutes to alert members who were within the premises to get into the chamber. So I just want to find out, because of the new gadgets, maybe that procedure falls off. That's what I wanted to find out. Thank you.
Thank you very much, Honorable Member for Komanso Central. We will look into the sitting plan and look at the proposed name and the member so that they continue to enjoy the services of this House. For the issue of ringing a bell and proceeding and procedural, Honorable Member, procedures of this House do allow us to ring a bell when we are doing a division, when it's a division on anything. But for the roll call, we go straight into the roll call, signing in. And for today, we did give enough time for members that were running to sign in to come and sign in on the gadget. But for now, our technicians are looking at the final list and rearranging it to suit the proposal from the Honorable Member from Nkatabe Central and the Lilongwe Msinja. And for now, the proposal from the Honorable Member for Zomba City North on us proceeding with business, we are consulting on the same, if we need to abandon this and proceed with business. But for the decorum of this House, Leader, we may need your indulgence on the same. Leader?
First, Deputy Speaker, good morning. Since today is a private members' day, we thought the members themselves would want to decide. But if it is their wish that the motion that was able to pass by this House for us to go into a division be set aside, for us to proceed with business, for us we are ready with business. Actually, like I've been complaining, at times we waste time. Time that would have been properly utilized is being wasted because of this back and forth movement. We have business that we want to dispose of. So if it is the view of the House that we abandon this process and move with business, from our end, we're glad. I submit, First Deputy Speaker.
Thank you very much, honour members. Just to give a summary, that at signing in this morning, only 78 members of parliament were in the House. 78 members of parliament were in the House out of the 226. And 2 honour members have no gadgets. We've included them on the signed in. So 78 members were present in the House. So we will proceed with business, and I will recognize a point of order from the people of Blantyre City Misesa, Sochi constituency. What has gone out of order before we continue with business?
Thank you very much, First Deputy Speaker. Order to record the Blantyre City Jijiri Misesa as absent, whilst he's rightly sitting on his seat. I would like to register that the Blantyre City Jijiri Misesa is in the House to represent the people of Blantyre City Jijiri Misesa.
Thank you. Thank you very much, Honour Member. As you are aware, our starting time for business for this House is 9:30, and we could have chosen 7:30, 8:30, but we decided to choose 9:30 to allow members of the cabinet to visit their offices for immediate works before they arrive here. And considering that, honorable colleagues, you are not provided by parliamentary accommodation, you are not coming from one position. We know some drivers as Salima, every day, Kasungu, Deza, every day, Mchinji. So we accommodated you. You have time to arrive here. 9:30, only 78 members were in this House. So those that were not here, it doesn't mean that you are absent, honour member. You are here, but you were late. You were very late to report for work. And very, very late. I hope you will consider coming on time next time you come to this House. And all procedures of this House, according to our own standing orders, will be implemented on you, honourable member, Blantyre Jijiri Misesa. All procedures will be implemented on you today. So you appreciate the advantages of coming in late to work. Thank you very much. I therefore rule. And good morning. Honour members, we will...
General business, questions on notice to ministers for oral replies.
Leader, which questions should we start with? Guidance, please.
First, Deputy Speaker, today we start with questions under Ministry of Health. When done, we'll move to questions under Ministry of Energy, and then Ministry of Transport and Public Works, in that order.
Thank you very much, Leader, for that guidance. Honour members, we now go to today's questions, Ministry of Health and Sanitation. Question 152. The Honourable Member for Kasungu Central. Kasungu Central, you have the floor, sir.
So much for recognizing the people of Kaomba, Suza, Mawango, Kapaizi. I rise to confirm that the question appearing on the order paper today is coming from the people of Kasungu Central. Thank you.
Thank you. Honour Minister.
Thank you, Mr. First Deputy Speaker. And through you, let me thank the Honourable Member for Kasungu Central for his question, which is to ask my ministry when the ministry plans to officially open the Gogode maternity wing and provide the necessary utilities, and whether the ministry is aware of theft of materials previously supplied by Gogode at Gogode Clinic. Mr. First Deputy Speaker, sir, let me commend the honorable member for his interest in improving access to health services. My ministry is aware that the maternity wing at Gogode Clinic requires medical equipment and medical furniture to facilitate its opening. Mr. First Deputy Speaker, sir, my ministry will leverage on availability of 5 billion constituency development fund that has been allocated to Kasungu Central constituency to purchase the equipment and accessories for the maternity wing. Mr. First Deputy Speaker, sir, I therefore would like to request the honorable member to prioritize Gogode maternity wing in the CDF plan, so that part of the CDF should be used to purchase medical equipment and other accessories for Gogode maternity wing to expedite its opening. My ministry will therefore officially open the facility once it is fully equipped. Mr. First Deputy Speaker, sir, as for the issue of theft of materials at Gogode Clinic, my ministry is working in collaboration with the Director of Health Services for Kasungu to investigate the theft issue and bring the culprits to book. Therefore, I'll be able to share the findings with the honorable member as soon as investigations are concluded. I thank you, Mr. First Deputy Speaker.
Thank you, Honourable Minister, for the feedback. I will, honourable members, you cannot just rise to say point of order. You know the procedure. Okay. What has gone out of order? Honourable member for Leza Kasina.
Good morning, First Deputy Speaker. Is it in order that our beloved ministers, when they are referring to CDF, they keep referring it as 5 billion, when we know it's not 5 billion? Because out of 5 billion, the councils have taken their share. Some are taking some percentages to construct DC's office, DC's house, and what. So can we say it's 3 billion? In actual sense, it's 3 billion. The actual sense is 3 billion, which is going to constituency. 2 billion is staying at the council. So is it in order that the ministers should keep referring 5 billion going to a constituency when it's only 3 billion going into constituency?
Honourable member, thank you very much. Honourable member, thank you very much. You have addressed a point of order to my office. Let me respond. Order, honourable members, order. Order to my right. Order to my left. Order. Honourable members, a point of order is addressed to the chair, and the chair seated this morning is the First Deputy Speaker of Parliament, and this is my response to the point of order. Honourable member, government has decentralized 5 billion kwacha. That 5 billion has gone for decentralization under the CDF projects, but the guidelines as approved, as seen and approved by this House, requires us to allocate those funds according to the guidelines. So whatever ends up into your constituency, it has gone to your district council, it has gone through bursaries, it has gone through a lot of other issues in your constituency. So we still call it 5 billion kwacha constituency development fund. Thank you very much. So I rule you out of order, honourable member. Supplementary, the owner of the question. Let's get you connected, owner of the question. And then in Cheu Central, we will add you back, but I've recognized you. The owner of the question needs to be highlighted. Please request for a microphone. You have. For the first supplementary question, sir, you have the floor.
Thank you so much, First Deputy. Thank you so much. Thanks, Deputy Speaker, for recognizing again the people of Kasungu Central on a supplementary question. First of all, I'd like to appreciate the able minister for her response to the question of the people of Kasungu Central. Before I ask the supplementary question, I just want to remind the Honorable Minister of Health that today is exactly 8 months, 24 days, 44 minutes. Exactly, she promised the people of Gogode that she will visit. This is a house of records. She stood over there and said she will visit. 9 months later, she didn't visit. She doesn't pick calls on the matter. And when we raised this issue of Gogode, that time we were assured that government will look into the matter. We appreciate the policy direction, the decentralization that has been alluded to, that we need to prioritize the Gogode hospital. We've done that. We've wasted 9 months because we were waiting on her. We have prioritized that, but at our council now, the funds are not yet there. We appreciate the people of Gogode would like to just know if you are still visiting or they should forget that you are visiting them. Thank you so much. I submit.
Honourable member, next time you raise a supplementary question, please avoid referring to the minister in person, because the visit can be the ministry, can be the minister. So if you refer to her in person, she doesn't carry the ministry everywhere she goes. The ministry continues even while she's here. She is only the minister of health, not the ministry of health. Thank you very much. I rule you. The second supplementary question is for, I did recognize the honourable member for Nchewu. We will deal with the Nkatabe West. Nkatabe West, you have the floor to create space for the honourable member for Nchewu. Nkatabe West, where are you standing? Oh, please, you have the floor. Oh, you switched yourself off. Nkatabe Central. You have the floor, sir. You have the floor.
Thank you, Right Honorable First Deputy Speaker, sir. I just want to ask the supplementary question or to bring the attention to the Minister of Health. We got Chesam Health Facility. As I'm talking, I was informed that the health workers, they are suspending their works because they can't work. They don't have water. Luckily, during the colonial era, we had water tanks there. They are there. But what we're asking, if there can be any provision of water system, whether it's borehole or submerged pumps, we will appreciate from the minister. Otherwise, there is no any health worker who can work without water. How can they treat the patients? So we are appealing to the minister if they can assist with water at the moment while we are budgeting for the CDF money. Thank you, Minister.
Thank you very much. The people from Nkatabe West. We are still trying to create space for the honourable member for Nchewu. Was that Nchewu Central West or Nchewu? What constituency is that, sir? You have the floor for a supplementary question.
Thank you very much, Rat, First Deputy Speaker, for recognizing the people of Nchewu Central East to ask the Minister of Health to consider upgrading Birira Health Center to a rural hospital. The honorable member from Nchewu Central East is asking the minister to upgrade this Birira Health Center to a rural hospital just because there are a lot of women, the population is densely populated, and the Njeu District Hospital is in the peripheral area, about 70 kilometers away from Biria Health Center. So if we have maternal complications, it becomes very difficult to transport these ladies to Njeu District Hospital. Thank you, First Deputy Speaker.
Thank you. I will take the honorable member from Nsanje Central for the last supplementary question.
Thank you very much, First Deputy Speaker, sir, for recognizing the people of Nsanje Central to provide or to give a supplementary question. First Deputy Speaker, the people of Nsanje Central would like to ask the Minister of Health to consider increasing the budgetary allocation for Nsanje DHO because of two reasons. One, that all the referrals from Nsanje are supposed to go to Queen Elizabeth Central Hospital, which is about 250 kilometers away. And we are spending a lot of money to support the DHO transport our patients, more especially emergency patients. Just one trip, you are spending closer to 500,000. So even an MP to support, it is becoming a huge challenge. Secondly, it's because as a hospital, Nsanje also supports our brothers and sisters from Mozambique. It's a huge population, but when the budgetary allocations are being provided, the population that is taken into consideration is only that of Nsanje as a district. But in fact, in true sense, the DHO supports a huge population if you consider the people that are coming from Mozambique, because we support them as our brothers and sisters. Therefore, can the minister consider increasing the budgetary allocation for the DHO, more especially for fuel? As I'm speaking, we are struggling. We are supporting the DHO, but we cannot continue doing that because it's really very expensive. I thank you, Mr. First Deputy Speaker, sir.
Thank you, Honorable Minister, for those questions.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the owner of the original question, the Honorable Member for Kasungu Central. I understand his concern for Gogode Health Center. My advice to honorable members of the House is to accept the reality and changes that are happening. The President of Malawi, Professor Arthur Peter Mutharika, has given us the powers to prioritize development activities within our constituencies and also at the council level. And currently, as the processes are happening, I'm advising the honorable member to prioritize equipments that are needed for this health center under the CDF, so that the people of Kasungu Central can have this health center functional, and my ministry, as I've advised, is ready and willing to come and open the health facility. Thank you. I would also like to thank the honorable member from Nkatabe West for his supplementary question on the issue of water at a facility in Nkatabe West that I didn't capture properly. I would like to advise the honorable member that my ministry has taken note of the water challenge at the facility. However, at district level, I'm advising him to take it up with the ministry responsible for water, just to make sure that there is a proper water allocation at the facility, and the people of Nkatabe West should be assisted under this health facility. Mr. First Deputy Speaker, I would also like to thank the honorable member for Njeu Central East, who has asked my ministry to consider upgrading Bilira Health Center to a rural hospital. Mr. First Deputy Speaker, Once all assessments are conducted, indeed to assess if Ibilila Health Center has enough space, if Ibilila Health Center is surrounded by other facilities that can benefit from the community hospital, and if Ibilila can be able to accommodate several houses and the equipments and everything else that is required for a rural hospital, my ministry will ensure that we actively look for resources to ensure that Ibilila Health Center is upgraded to a rural hospital. I would also like to thank Sanje Central for asking my ministry to consider increasing budget allocation for Sanje DHO. Thank you so much for this request to my ministry. This has been noted and it will be looked into, especially during mid-year review. Thank you, Mr. First Deputy Speaker.
Thank you very much. So the honourable member from Kadabi West, please liaise with the council and the honourable Minister of Water Sanitation for your question to be responded to. And I think that's the direction that has been given. We go to question number 153. The honourable member for Ncheu Zonzi Mvai. The honourable member for Ncheu Zonzi Mvai, please request for a microphone if you are in the house. You have the floor. Is the honourable member in the house? The honourable member for Ncheu Zonzi Mvai is not in the house. We go to the honourable, question 154, the honourable member from Zimba South West. Honourable member from Zimba South West, you will be accommodated on the gadget very soon. Please request. You have the floor.
Thank you very much, First Deputy Speaker. Indeed, this question is mine. Thank you.
When a senior member confirms a question like that, the chair seated here has no any objection. Just to say thank you very much for confirming your question, sir. Honourable Minister.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the honorable member from Zimba Southwest for his question, which is to ask my ministry what plans government has to complete the construction of a Dingeni Rural Hospital, where works have stalled despite communities waiting for remaining wards. Mr. First Deputy Speaker, sir, my ministry is aware of the status of a Dingeni Health Facility, which was earmarked for upgrading into a rural hospital alongside other facilities in Nzimba South, like Jenda, Bulala, and Eutini. Mr. First Deputy Speaker, sir, I would wish to clarify that construction works at Edingeni have not stalled. However, the existing infrastructure at the facility requires significant upgrading and expansion in order to meet the standards of a fully functional rural hospital. The current structures are not yet adequate to support the full range of services expected at that level of care to be provided at a community hospital, including inpatient wards, theater services, diagnostics, and staff accommodation. Mr. First Deputy Speaker, sir, My ministry remains committed to the progressive upgrading of Edingeni into a rural hospital. At present, priority has been placed on completing ongoing infrastructure development projects at Gender and Eltini rural hospitals, where substantial investments have already been made and where infrastructure is at a more advanced stage. Nevertheless, Mr. First Deputy Speaker, Edingeni remains part of the ministry's integrated capital investment plan. My ministry is actively mobilizing resources to ensure that all earmarked facilities, including Edingeni, are eventually upgraded to provide comprehensive services to the communities they serve. In particular, the CDF will be leveraged to support such upgrades. Mr. First Deputy Speaker, sir, in the meantime, the ministry continues to support Edingeni Health Facility with essential health services, staffing, and medical supplies to ensure that the population continues to access care as infrastructure development progresses. Mr. First Deputy Speaker, once fully upgraded, Edingeni will significantly improve access to quality healthcare services, reduce referral distances, and contribute to improved health outcomes in Mzimba Southwest constituency. I thank you, Mr. First Deputy Speaker.
Thank you. I now recognize the Honourable Member for Palombe South for a supplementary question. Honourable Member, you have the floor.
The honor of the question.
The honor of the question is on the floor. So, Honourable Member for Palombe South, I've already recognized you. We will yield to the honor of the question. So, I will remove Palombe South for now. So, the honor of the question can appear on the You have the floor, sir.
Thank you very much, First Deputy Speaker. You forgive us when these gadgets, when you and I were coming in this honorable house, these gadgets were not there. So the house should forgive us when it takes time for some of us. However, I just want to thank the Honorable Minister through you for an elaborate answer given to me. Let me also extend a simple but very important invitation from His Majesty King Mberwa and the rest of us so that the Honorable Minister can appreciate what is on the ground at Edingeni Rural Health Center and the land that the King had already allocated to this rural hospital. I submit.
Thank you. Palombe South. You have the floor, Madam.
Thank you, Mr. First Deputy Speaker, for accommodating the people of Palombe South to ask a supplementary question to the Minister of Health. I stand because I've once said in this house that Palombe South doesn't have a government hospital, a government health post, or a government health facility of any sort. So as part of CDF priorities, my constituency prioritized a healthy post that was under construction. We want to upgrade it using CDF, which we are in order on that. But my concern right now, Mr. First Deputy Speaker, is the only hospital that we rely on in the constituency, Holy Family Mission Hospital, is on the service level agreement with the government to serve the catchment area of around Palombe South. But right now, the funds have been reduced, and the hospital can no longer serve the population that it was serving. So this issue is of a great concern because people of Palombe South, they don't have access to healthy care as it is. So may the Minister of Health, the Minister of Health, consider revising again the funds towards Holy Family Mission Hospital so that our mothers, our children should be well taken care of. Another issue, Mr. First Deputy Speaker, sir, let me take this opportunity. I stand as one of the midwives in Malawi, trained as a midwife. It's a concern because we have got a very huge gap and deficit in midwives in Malawi, and we continue to see deaths of maternal and newborn babies. I don't know if it's a proper platform that I can say this, but the gap is too huge now. We've got a shortage of 8,000 midwives that the government needs to recruit. Mr. First Deputy Speaker, sir, let me take this opportunity to ask the Minister of Health when they are considering to push, now that there is this lift of recruitment, that government now has lifted the ban of recruitment. May the ministry consider recruiting more midwives so that the gap should be decreased, but also not just recruiting them, but also let's invest in our midwives. We keep losing midwives going abroad.
Thank you. Thank you, Honourable Member. Thank you very much. I will recognize the Honourable Member for Blantyre City, Chichiri Misesa.
Can I be protected, Chair?
Honourable Member, I don't know what protection you are looking for. We used to know you as a protection officer for the party. I don't know what type of protection you are looking for, but if for this house, you are fully protected, sir. Please, you have the floor.
Thank you, Chair. Thank you very much for recognizing the people of Blantyre City, Chichiri Misesa, Tie Kapeni, Group Village Chiwembe, Village Chemboma, Group Village Chemboma, Group Village Headwoman Misesa. First Deputy Speaker, I would like to ask the Minister of Health and Sanitation, through the Minister here present, to pronounce herself if they have the plans to extend the Limbe Health Center. The Limbe Health Center is situated at the center of Limbe, behind Limbe Market, where the catchment area is very, very vast. We are talking of people from Chinyonga, people from Chichiri, people from Mudi. We have people from Limbe proper town, villages. We go as far as the group village Chentambo in Chigumula. We have Manje, Namame, Chekimu, Ndogolo. You can see that he is servicing quite a very big number of people. I would like to ask the able Minister of Health and Sanitation through her ministry if they have got plans to extend this hospital so that they can give a good service to the people. We have heard about CDF. We understand the issues as regards to CDF, but the ministry had plans, and I remember the Deputy Minister of Health did visit the place, and people are still asking as to when this project will start. So if the minister is aware, could she pronounce herself?
Thank you.
Thank you very much, Chair.
Thank you, Honourable Member. The last supplementary on this is from Desa Kasina.
Thank you so much, First Deputy Speaker, for recognizing the good people of the Zagasina to ask the supplementary questions. Chair, I need protection because the Member of Parliament for... Chair, this morning I wanted to ask the beautiful Minister of Health if what it takes to consider upgrading Chito Health Center and Kapuga Health Center. They are already on the plan under CDF, but we would want the minister's approval that Chito Health Center and the Kapuga Health Center can be upgraded to a rural community health center. I submit, First Deputy Speaker.
Thank you very much, Honourable Minister. You have the floor, Honourable Minister.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the people of Mzimba Southwest for the supplementary invitation to Mzimba Southwest so that I can see for myself the health center, which was being asked to be completed. I've taken note of the invitation. Mr. First Deputy Speaker, I'm also thanking the people of Palombe South. My ministry is aware that Palombe South does not have a public facility, and currently they're utilizing a Holy Family facility, which is not a public facility, but under CHAM. Mr. First Deputy Speaker, I would like to commend the people of Palombe South for prioritizing construction of a health facility in Palombe South. And the issue about reduction of funding to Holy Family Mission, I've taken note of it and I'll provide a response to the honorable member once I know what exactly is happening. Mr. First Deputy Speaker, I would also like to speak about the issue of workers that Palombe South has mentioned in the House. I'm sure honorable member for Palombe South has seen the waiver that we have just gotten. The Ministry of Health and other ministries. We are thanking the President of Malawi, Professor Arthur Peter Mutharika, for that waiver, and we know that recruitments will take place. Once all the processes are ready, we will be ready to recruit. Mr. First Deputy Speaker, I would like to thank the people of Blantyre City, Chichiri Misesa, who are asking my ministry to look into Limbi Health Center and consider expanding it as it is serving a large population. For example, the people around Limbi, the people from Mudi, GVH, Chentambo, Manje, Cheakimu, and other places. Mr. First Deputy Speaker, I've taken note of this and I would like to put it on record as I've been presenting it in the other days that my ministry has plans to upgrade health centers within our major cities as a way of decongesting the central hospitals. And the Limbi Health Center is one of them. So the people of Blantyre City, Chichiri Misesa, should not really be worried as the plans are in place. I would also like to thank the people of Desakasina who are asking my ministry to consider upgrading Chitowe and Kapuka. Chitowo and Kapuka. And he has mentioned that these have already been prioritized under the CDF, but they need an okay from my ministry. Mr. First Deputy Speaker, my ministry has a register of all the health facilities that are in the country that are to be upgraded to community hospitals. And I would like to invite the honorable member to my office so that we can together check that register if Chito and Kapuka is in there. Thank you, Mr. First Deputy Speaker.
Thank you very much, Honourable Ministers. At times you wonder what type of people you invite to your offices, but your job is very public. It needs to invite everyone. If you were to be going through my office of who to invite, Honourable Minister, some members will not be recommended for such an invitation. But congratulations, Honourable Member, for the Zagasina. And thank you very much that you are going there now. Honourable members, we go to question number 155. The honourable member, the honourable pastor for Deza Chikoma. Honourable member for Deza Chikoma constituency. Some members didn't know you were a pastor, so we need to get you on the microphone. You have the floor. You have the floor, sir.
Thank you. Thank you, Honorable First Deputy Speaker, for allowing the Chikoma to confirm his question. And I rise to confirm that indeed question 155 is coming from the people of the Chikoma constituency, the people of Senior Chief Kachere, and also T.A. Chirikumwendo. Thank you, Honorable Speaker.
Thank you, Honorable Minister. You have the floor, Madam.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the honorable member for Deza Chikoma, who is asking my ministry whether government will consider bringing into operation the health post constructed at Kanolo with support from Global Fund. While construction is complete, the facility still requires medical equipment and staff to begin operation. Mr. First Deputy Speaker, and through you, I would like to respond to Deza Chikoma, acknowledging that the facility in question has indeed been finalized in terms of construction, and currently my ministry is liaising with the district's health office to ensure that it is staffed, and any gaps in terms of equipment, we are going to make sure and work with the DC to ensure that it is equipped so that the people of Deza Chikoma can access health services at nearby facility. I thank you.
Thank you very much. In the following order for supplementary, Mangochi West, then Salima Central. You have the floor, Mangochi West.
Thank you very much, First Deputy Speaker, sir.
Good morning, Honourable Minister of Finance.
Thank you very much, the First Deputy Speaker, sir, for the chance of people of Mangochi West to ask a supplementary question to the Minister of Health and Sanitation. And through you, the First Deputy Speaker, sir, the people of Mangochi West would like to get guidance from the Minister of what would happen to an area which is being surrounded by charm facilities. I'm asking this having in mind the area of Marembo. We have a mission hospital, and the nearest hospitals at Nankwali also is another charm Hospital, due to sales-levy agreement which is there between camp authorities and the government, they say where there is such facilities, we must not construct another government facility. And yet, these facilities, they only provide services to antenatal and neonatal services. But we have got people who are about 5 years, and a lot of them cannot manage to pay for the services of such facilities. Now, with such a situation, Madam Minister, what can you advise the people of Mangochi West to help the poor people who are within this area? Thank you, the first Deputy Speaker, sir.
Thank you. We go to the honour member for Salima Central. Sir, you have the floor.
Thank you so much, the first Deputy Speaker, for according the people of Salima Central to make a submission to the able Minister of Health. First Deputy Speaker, in Salima Central constituency, we have a tissue hospital, which is doing well. People are getting the services much better there. But between 2019 and 2025, the people of Salima Central really wanted to open another OPD, and we used the CDF funds to maintain the old hospital, which was there before the new hospital, just to make sure that we decongest the main hospital. As I'm speaking, almost everything has been done with funding from CDF and other partners. But we have a problem. We have not opened this facility. It's called Simaiwa OPD, but whenever I engage the council, they say they are working on the policies so that this OPD should open. All the staff, including the medical personnel, the nurses, whoever, have been deployed. But for it to finally be open, there are challenges. I want to ask you, the first desk speaker, if the minister could come in and make sure the people of Salima Central start benefiting from the services of this already completed health facility. Thank you so much, first deputy speaker. Thank you.
Thank you. Then we go to the people of Mulanje West. Mulanje West, you have the floor.
Thank you so much, the Right Honourable First Deputy Speaker. Through you, I would like to ask the Minister of supplementary question to the Minister. But before that, I would like to thank the Minister for the Tuchira Health Center, which she is upgrading to Community Health Center, but also for the infrastructure built. And I would like to ask the Minister if he can facilitate the finishing up the facility of the theater and start operating. As much as I do appreciate her that she has done the rest of the work, especially attending to the patient directly from Tuchira Health Center to Queen Elizabeth Center Hospital. This is a thing which cannot go without patting her at her back, but just to ask her if he can come and open the theater so that the operation can be taking place at Tuchira Community Health Center, if I may say so, but also looking into the maternity wing at Chimbalanga Health Center. Thank you so much, the Right Honourable First Deputy Speaker.
Thank you. Honourable Minister. You have the floor, Madam.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the honorable member from Mangochi West, who is looking for guidance from my ministry especially on the service level agreements with the mission hospitals around his constituency, considering there is no public facility and the mission hospitals through the service level agreements that are there only provide free services to infants and pregnant mothers and neglecting the other people that are not infants and pregnant women. Mr. First Deputy Speaker, his question is policy in nature and is speaking to the service level agreement that was signed between the ministry and the mission hospital. So I would like to advise the honorable member that once I get clarity on that policy where it says a public hospital cannot be constructed where there are mission hospitals, I will get back to him with a proper answer. Mr. First Deputy Speaker, I would like to thank Salima Central, who is asking my ministry to facilitate opening of the new OPD that was constructed. It was staffed, but it's not open, and they are waiting for instruction from my ministry. I would like to assure the people of Salima Central that I will personally look into this and speed up the process just to make sure that the OPD that was constructed with a very good intention to congest the district hospital is put into operation and the people of Salima and around areas are able to access the services. I would also like to thank the honorable member for Mulanje West, who is asking my ministry to facilitate finishing up of Tuchira Health Center Theatre, which is constructed, just remaining a few works for it to be finalized and opened, and also to look into the maternity at the Jimbalanga. I have taken note of this request, and my ministry will ensure that Tuchira Theatre, which is already constructed, remaining with few touches, is finished and it's put into use. I thank you, Mr. First Deputy Speaker.
Thank you. We have one more question for this ministry, so rather finish it before we go for a healthy break. We will go to question 175. The honorable member for Baraka Ngwangwa. Baraka Ngwangwa. Baraka Ngwangwa is not in the house. We did also had the honorable member for Ncheuzozi Mvai. Is she in the house now? The honorable member is not also in the house. Honorable member, this marks the end. Honorable member, what has gone out of order? Blanta Limbi Misesa, what has gone out of order?
Chair is Blanta Sita Chichiri Misesa. Thank you very much for according the floor to the people of Chichiri Misesa. Today being Private Members' Day, I beg to move that we vary the order paper and go to bullet number 4, government business, immediately after we have returned from the health break, so that we can deal with government business. I beg to move.
Honourable Member, your motion is procedural, but we are looking at the level of business that we have that is private. Maybe we can negotiate to get to government after lunchtime, if that pleases you, so that honourable colleagues, so Honourable Minister, you are on the floor.
Thank you so much, Mr. First Deputy Speaker. Since we were tackling government business under the Ministry of Health, I wanted to put it on record that question number 175, it's a question that keeps coming back. It used to be 109 or something. It keeps coming back and the owner keeps saying he withdrew the question. Yeah, so I wanted to put it on record that it was withdrawn and because it will keep coming back. So, thank you.
Thank you, Honourable Minister. That question, as advised by you, it was withdrawn and we will treat it that way. And Honourable Member from Zimba South.
Through you, Mr. First Deputy Speaker, since today is Private Members' Day, after break time, let's proceed. I would like to beg to move that let's proceed to private members' business and mission constituency statements. I beg to move, Mr. First Deputy Speaker.
Thank you very much, honourable members. There's a motion on the floor. The motion is to concentrate on private members' business. Constituency statement when we come back from the health break. Those of that opinion say aye. Those of the contrary opinion say no. The ayes have it and the motion is carried. Honourable members, we will proceed as advised after the health break. But I see the honourable member for Chirazo, who has never stood for a point of order, wants to raise a point of order. So if someone like that is on the floor, you have to be prepared. Honourable member, what has gone out of order?
Thank you very much, First Deputy Speaker. I wanted to put it on record that on Monday and Tuesday I was not in the house. I went to hand over a very beautiful health post in my constituency. And during that day, I had question 110, and our chief whip correctly informed the speaker that I had sent an apology, but it's no longer appearing on the order paper. So I wanted to put that on record. Thank you. Yes, under Minister of Health. Question number 110.
It was 117.
110.
110.
Yeah.
Honourable member, we will look into that.
Ambiri mwakhala mukudera nkhawa kuti kodi mavuto amene tili nawowa tidzathetse bwanji. Mavuto ngati kusabereka, khunyu, misala, kodi mukufuna chikoka cha business, mukufuna kulanga wakuba, magic wallet, kukwezedwa pa ntchito, kapena mukufuna kutsirika thupi, kuwinitsa loto ndi zina zambiri. Yankho la zonsezi lapezeka.
Kodi muli ndi vuto la kusabeleka, khunyu, misala, mukufuna chikoka pa business yanu, mukufuna kulanga wakuba, mukufuna magic wallet, mukufuna kukwezedwa pa ntchito, kutsirika thupi, kuwinitsa loto ndi zina zambiri.
Dr. Makoti, omwe amapezeka ku Blantyre Lilongwe Salima komanso Kasungu, amenewa ali ndi yankho la mavuto onsewa. Imbani foni 090 815572 kapena 089142038 kapena mutha kuyankhula nawo pa WhatsApp pa nambala ya 0893 004116. Mukatero muyankhulana ndi Dr. Makoti pa WhatsApp. Dr. Makoti, Dr. Makoti, mavuto aja aone msana wa njira.
Kodi muli ndi vuto la kusabeleka, khunyu, misala, mukufuna chikoka pa business yanu, mukufuna kulanga wakuba, mukufuna magic wallet, mukufuna kukwezedwa pa ntchito, kutsirika thupi.
mayesayesa ntchito sikupezeka, mwana mnyumba kusowabe, chitaka pa bizinesi yanu chakusokonezani. Wosadandaula kuli Dr. Maiye Kumbulumbudzi.
Muitano wa bizinesi mwai wa nchito kukonza nsoma banja kusula chibelekero.
Matenda okanika kuchirawo, matsoka osatha pa moyo wanuwo, lero pabanja makukuthothani. Wosadandaula tangoimbani foni pa 0894 352 832 0894 352 832. Dr. Maiye, madotolo wa chinyengo musamale. Kodi munamvapo za Dr. Erube kwa Vumbwe?
Dokota Erube, Dokota Erube. Dokota Erube, Dokota Erube.
Kodi mukufuna mwitano wa bizinesi mtupatupa? Timabwezeresa banja likasokonekera kwa mphindi 40. Timatsirika munthu akaberedwa. Chuma, bizinesi ziziyenda bwino, bwerani kwa Dr. Erube kumene timathandiza zonsezi. Nkhani zachitaka zavuta, bwerani kwa Dr. Erube. Timathandizanso mwitano komanso kuvalirana anthu nkhope. Mukafuna kudziwa zambiri, imbani foni pa 089 94 26491 0899 426491, ndipo mukatero mudzathandizidwa. Dr. Erube, Dr. Erube, Dr. Erube, anachepa.
Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.